Accountable care organizations are a new type of provider entity, doctors and hospitals that come together to take care of a population of patients. Historically, providers were paid on a volume approach. The more you do, the more you get compensated. The ACO, the Accountable Care Organization, this new entity will get compensated alternatively based on performance. And that performance means their ability to manage the economics of care as well as the clinical outcomes. So to be a successful ACO, successful group of providers, you have to be cautious and careful about the resources that you use, and you're going to be provided bonuses based upon how well the patients do from a clinical outcome standpoint. There are many factors that will be relevant to the success of an ACO. Many of these have nothing to do specifically with medications. It could be, who are the providers in the network? Who are the doctors? Who are the hospitals? Do you have a physician leader who can drive change from a cultural standpoint? There are issues about data and data systems. There's many, many areas. However, from the standpoint of medications, to be successful, first and foremost is to realize the importance of medications in this environment. Often people think, well, medications, they are important and they're a cost of providing care. But in the ACO environment, medications are critical to the overall episode of care costs and to the quality that the patients achieve. So first and foremost, it's in a realization of how medications are critical to success. Once you've made that realization, then there's a series of processes you would want to put into place to best manage the medication use by those patients. Our early work in this space looked at the conceptual issues regarding ACOs and medications. Well, the next logical step was to ask the question, are ACOs ready to do this? Are they ready to optimally manage medications in this new environment? So to do that, we actually had to go out to ACOs and ask them what they're doing, what they're able to do, what they're not able to do. And we have done this phase of our research in collaboration with the American Medical Group Association, the Premier Healthcare Alliance, and as well Dartmouth. And so we put together a survey, went to about 43 different ACOs, actual up and running provider entities, and asked them a series of 16 questions about what they're able to do and what they're not able to do. And it was fascinating what we found. Sadly, relatively few of the items that we think would be critical to do a good job are actually in place. One of the areas that most ACOs are ready to do is they are able to do electronic prescribing, which is critical because that allows you to electronically capture what's been recommended, and that will be critical moving forward. Another element that ACOs seem pretty ready to do is the ability for a physician, when you come to see the physician as a patient, to look in your record and see the list of medications that you're currently receiving. So those are the good areas. However, there's a whole lot of areas that have opportunities for improvement. Some of those include the ability to combine pharmacy data with medical data, which one might think is straightforward, but actually they often come in on two different data systems. And to really understand whether medications are used properly or not, you need to combine those two data sources. Very few of the ACOs are able to do that. Another critical element is knowing when a patient picks up their medicine or doesn't pick up their medicine. So when a physician writes a prescription, it's critical that that physician know whether you actually picked up the medicine. And because there's often multiple doctors involved in taking care of one patient, each of the physicians needs to know when others are prescribing for your patient. So the ability to notify doctors when other prescriptions are being written, again, very few of these groups are able to do that. Moving forward, I think it's critically important for ACOs to realize that medications are an element of care, they are a cost of care, and they shouldn't just focus on it economically of the cost of the medications, but to look very broadly at the impact of the medications on the full episode of care and the cost of that episode, which is critical for the success of the ACO. And that medications are also critically important into achieving clinical success. Again, how they're going to be provided bonuses. So did they reach cholesterol control? Did they have their blood sugar at the levels it needs to be for a diabetic, and their hypertension within the proper ranges? To do that successfully, ACOs have a whole series of elements that they need to think about. Everything from helping the patient to make proper choices about medications and staying on those medications, to being able to monitor it from a patient and a population level. And that the ACO needs to think carefully about all these different steps when they're working with the patient, working with the individual doctors to reach that point of success.